Hi everyone, welcome back to North of the Broad. Abbie Shaw has joined us. She is a community health worker with a Good Neighbor Medical Clinic right here in Beaufort. Actually, she's an employee of AmeriCorps and started with them last summer, and you really enjoyed your work. You actually volunteered with the medical clinic, and then now you're employed with AmeriCorps and doing great work. So welcome to the show.
Thank you for having me.
So let's talk about what is a community health worker? What services do you provide?
So as you mentioned, I'm through AmeriCorps, and they have a public health program where I've been put into the clinic. And essentially my role is to address social determinants of health. What that means is I essentially try to address needs in the community apart from healthcare. So that could be someone's socioeconomic status, anything in their living, working environment that may affect their ability to receive healthcare, be the healthiest that they can be. That's what we try to address.
And a lot of people don't realize that that's huge, that you've got the physical, the medical side, but the social side really can impact whether people get healthcare. There are a lot of barriers, a lot of challenges. And so, someone like you out in the community ferreting those folks out and helping to eliminate some of those barriers is so critical. So have you enjoyed it?
I've loved my time with AmeriCorps thus far, and especially at Good Neighbor Medical Clinic. It's such a great place, and like you mentioned, I volunteered there before, and I just fell in love with all of the people, the patients. It's just a great environment to be in.
Now, you said that you are interested in being a doctor, and you've applied to medical school, and this experience, what has it taught you that will make you a better doctor?
So I think one of the most important things that it's taught me is how to communicate with people and understand that their needs extend far beyond just the medical setting. So one thing that I do that I think is really important is we look at our hypertensive, so high blood pressure, diabetic patients. And the doctor might say, okay, well, you need to do XYZ. Well, maybe they go sit with me and I say, how's your home life doing? How do you feel about your ability to go out and get groceries? Are you able to get around the way that you need to? And all of those things impact your health so much. So I think just understanding the whole person is something that I'll really take away from this experience.
Right. And so AmeriCorps, that's a great partnership with the Good Neighbor Medical Clinic. It's been ongoing for several years, and I think it's just really exciting that actually you all have two community health workers, where a lot of health clinics, free health clinics, don't have two. They don't even have one.
Absolutely, and we're so fortunate, especially because we're able to split up the roles a little bit and just have a further reach within the community than we would with just one community health worker. So we're very, very lucky in that way.
Do most patients, are they receptive to your advice, your help, your support, or are they a little bit they're not quite sure exactly what you're doing and the service that you're providing?
Building rapport is really, really important with our patient population, and that's why we make sure to meet with every single new patient. We do intake appointments on Mondays, and so after they meet with the nurse, they'll come out and meet with us, where they're made aware of some of the services and partnerships that we have, and just different ways that we may be able to help them. Right. So over time, they definitely will warm up.
And you mentioned partnerships, and I think you had just come from a meeting with the vocational...
Yes, with vocational rehab.
Right, and so you have many partners resources that you can, funnel folks, not funnel, but guide them to, right?
Absolutely. So one thing that we're really, really fortunate to be able to do is coordinate transportation for our patients. That's a very, very big need. So through Lowcountry outreach, we're able to get patients to all of their medical appointments.
Right.
Lowcountry legal volunteers.
Love that organization.
That's another big one.
Yes.
And they're really involved with just getting into the clinic and wanting to help people. And then we also refer people out to them when they're having legal issues that they might be able to help with. So
very good. Very good. Well, congratulations on your work, your service. Good luck getting into medical school. I know it'll be a breeze.
Thank you so much.
And I know the Good Neighbor Medical Clinic is so happy to have you there.
Oh, well, I'm happy to be there.
Thank you. Abbie Shaw with the Good Neighbor Medical Clinic, and we'll be right back with more North of the Broad. Don't go away.